so I can be somewhat intelligent. The coat and the bag anywhere you like, do whatever you like to look at, and then you get to sit there.
Oh, I'll just leave
I'm going to sit there.
Okay.
I'm going to put it in the workspace.
I'll just leave the bag on the upload.
No, you can if you want.
Yeah, fine.
So basically, let me preach to the choir. I've got my rest of the summary here, actually. And so it basically says back in 2012, in March, you had LASIK done with the mechanical flat maker for 5 and 3 units of nearsightedness, both nearsighted, one more than the other. And then this is where the issues became an issue. The issues became an issue. The right eye, we did that LASIK, scratch the eye retreatment in May the following year, 2013, because you picked up a bit of nearsightedness. And though the vision improved, it's varied a lot, and it's dropped back a little bit. But the overriding problem beyond dryness has been erosions.
Yeah.
And that's really, at times it's worse. At times you had acute abrasions. You went to East Grinstead, which is a great place to be. And subsequently, we've given you all sorts of different lubricants. Salt ointment is a mainstay for this type of thing. There are surgical things that can be done, which we'll review just for the sake of completeness. But we are at the point, you remember, last time when we met, which was about 11 months ago.
Yes, I was just being to East Grinstead.
That's right. Did you see those? Lots of Shiraz is there, mainly Shiraz Dyer. But you might have seen one of the other guys there. What's the other guy's name? I can't remember.
There's a Greek chap. Greek, youngish guy. I can't remember his name.
Alex Ionides is another guy, and he's at Moorfields. Anyway.
Yeah. But I thought they were going to sort me out, and I'm still nothing,
Give me a shopping list of, these are the things that I'm frustrated at, and this is what I want to address. So if I can guess, it's like the erosion's producing symptoms every night, you're not sleeping well, and the vision not being clear.
No, even with these glasses, I could throw these glasses away now. I'm finding it really a bit difficult to drive because of signposts, and I'm losing my confidence driving.
Yeah.
So I did say to whoever I saw last time, down East Grinstead.
Yeah.
I said to him, look, can I improve my sight? And he said, well, with the dryness you've got, it's very hard to improve it. So I want to change the lenses in these glasses.
Well, we have measurements today that we could use to do that. But the answer to the dryness thing is that if the dryness is manageable, and manageable means we getting a sense of what the symptoms are like, as much as I'm not going to see as much dryness as you're going to tell me about. But if the dryness were manageable, you were in the middle of the spectrum, perhaps, from bad to none at all, and we entertained laser retreatment, the great irony is that the procedure that created the erosions is normally a remedy for erosions. It allows you to repave the road. And so that's out there still. And then you'd say, really? A third procedure? How many times do you do a third procedure? The answer is 1 in 200. So a patient that sees me for the first time, when I look them in the eye, there's a 0.5% chance, statistically, they might be a three-timer. Generally, it tends to be someone that starts off very nearsighted, twice what you were, or very far-sighted, or having lots and lots of astigmatism, a rugby ball-shaped eye, not you. But anyone can get into that exclusive group, but those are the people who are looking to get into it. So that's the first thing to say. But the reason I'm saying the dryness would have to be middle of the road and manageable, because I'm definitely going to stoke the fire for 1 to 3 months at minimum, and there is the potential that the dryness could become more of a burden in the long term. More of a burden. If we did a third procedure to get rid of what's left in terms of nearsightedness, there are other forks in the road here, so this is just one road we're talking about. And so that's the issue. I try and in predicting the future and trying to be clairvoyant about what the dryness is like, I try and have my line in the sand is no more than 4 drops a day in perpetuity. And I got that number from patients in my own practice in the States. I asked the question, how many drops of lubricant a day forever? And you're still going to be happy that we've done this today? And the answer is 4. Breakfast, lunch, dinner, and bed. Because it's not dominating your life. So that's that. The left eye has dropped back a little bit in the last year, just a bit. And we made the point last time that, neither of us, that we're not old, we're not young, we're in the middle, you and I'm 51, and you're just a little bit north of that, just a bit. And as we get older, the lens inside the eye just changes a little bit, appropriate to age, not meaning, oh, you've got a cataract and it needs to come out as an emergency. Rather, it's just a bit of hair going grey type change, which I've got hidden under here. And with that hair going grey subtle change comes a little bit of nearsightedness, and that contributes to the nearsightedness changing. All right?
Yeah.
So let me have a look at the eyes, and I'll talk more about all of those things together. And
I thought laser treatment was going to be for life. I didn't think I was going to have this problem. When I had my consultation, that's what he told me. He said, you're a perfect candidate and you will have perfect life.
By the numbers looking at you, you would fall into the middle of the population where you would expect a 95% chance that we would achieve the goal with one procedure. A 4.5% chance you might be having two procedures, and that 0.5% maybe three. So you would fall in that. There was nothing. You weren't a statistical outlier. And in the sense that it's a permanent fixture, the living tissue that we operate on, in spite of it being a living tissue remodeling all the time, there is very little, amazingly, that changes the power of the eye in the 5 or even 10 years after the surgery. If you look at things that are published out to 5 or 6 or 7 years, we're talking about 1 or 2% of patients where we're kicking around the notion of an additional procedure. So your point is well made and well taken, and you have behaved more like an outlier than a zebra in the middle of the pack, well away from the lions. So I agree. So your observation is correct. Let's have a look and we'll keep chatting. So I understand the frustrations. I
have been told by somebody who worked in Optimac that I could only have ever got a year to 2 years out of it anyway.
Okay, right. Yeah. Well, that flies in the face of what's published and, my own experience. Let me just keep looking and we'll keep chatting. You can blink again. Now I can see there's an area of dryness, but I can also see, anytime you like, you can blink. I can see an area where it might be a location of where symptoms are happening. Let's have a look over here. Yeah, you can blink whenever you like. Yeah, the lens inside the eye, it would look probably the same as mine, frankly. A little bit of loss of perfect gin clarity, but age appropriate, and I bet it would look the same as mine. Sit back. Now, if we, first of all, talking about the erosion symptoms first, and then we'll get stepwise to all the others. If the lubrication at the moment, we're probably going to change it slightly today, but I told you to keep trying that sodium chloride ointment. What was your take on that? Did you like it, or in the end?
Yeah, it was okay. It was okay, but they changed me in the hospital to Lacrolube. And that's in both eyes, but I was using the sodium chloride in one eye.
Well, and do you think that when you went back to Lacrolube that it allowed the symptoms to return overnight, or not particularly?
The sodium chloride didn't work either.
Yeah, okay, that's what I'm after, because sodium chloride, the logic of that is that because it's a salt solution, it draws water towards itself like a magnet. And so it can pull water out of the epithelial or outer bread layer in the corneal sandwich, allowing it to stick down better, preventing erosions from happening, roughness from happening. If it doesn't work, Lacrolube is just a bland ointment, and often women hate it because any makeup, any eyeliner or mascara that's still on your eye, it's like snail tracking over your pillow afterwards in the morning. Women hate it.
Yeah, it's horrible.
Now, even though it's goopy, there is another ointment that Derek has pulled off the shelf, which we give to patients in the evening if they do not derive any benefit from sodium chloride, the salt ointment. It's called Lubrastil. It also is a bit Lacrolube. It's a bit like that.
Right.
But it would be worth trying. I'm just trying to find something that gives you overnight sort of comfort, because it's waking you up in the middle of the night, and you're sort of on tenterhooks as to whether to move your eye or not.
Yes. Well, I have to wait for it. I have to try and move my eye within the lid before I open my lid to try and make some,
Yeah.
because if I pull, it'll, pull the skin.
Sure. So the Lubrostil would be a worthwhile thing to try. Now, and the other things we'll talk about, he's talking the eye bag and lid massage while we're on the subject. What the eye bag does, it is just heat. It's a gel mask that goes in the microwave, comes out. The heat softens up and the oils in the eyelid, they can be expressed. And then by wiping with the Clean wipes, you're de-oiling the eyelids. You're getting the oil off the windscreen wipers, so when it rains, you don't get droplets of rain. You get a nice thin film of rain. Oily eyelids can destabilize the corneal tear film and make a dry eye seem more dry. And so that's the rationale for that. And the other things are basically to give you that comfort in terms of dryness, Optive Plus, and so we'll go through that in a moment. But so the overnight erosion thing, perhaps Lubrostil will help tackle it, but let's assume it doesn't. What if it doesn't? And you're still just demoralized night in, night out, thinking, I can't live like this. Whenever erosions become problematic like that, the three types of intervention, and I'm educating you, you don't have to do any of this, the three types of intervention would be, historically, the longest tried one, which I'm not going to recommend, is called anterior stromal puncture. It sounds awful. What it basically means is you have to know exactly where the imperfection or the roughened area is exactly, so that you can then, like a farmer in the old days with the spikes on his feet, aerating soil like this, you're pushing the bread layer into the sandwich filling in the at-risk area to promote a stronger adhesion. It's very rare that we would know exactly the location and get everything exactly. So you go through the mill in terms of symptoms and think, thanks, but it's still happening. Next on the list would be to debride the corneal epithelium, to scratch the eye again. As I said, it's somewhat counterintuitive because you'd say, Jonathan, are you retarded, Jonathan? Because you scratched my eye, it came, but it is, a well-documented way of bringing remedy to this type of thing. We're just scratching the eye again. Re-scratching the eye. It's like LASIK without the corrective procedure to change the power of the eye. And so what that does is it allows the surface of the cornea to be repaved, repopulated, and it can repopulate and stick down better. And I have done that in situations like this, and it has worked. So it's just food for thought, back burner knowledge. Sometimes we will get out a laser to function in a polishing mode when we have scratched the eye. That scratch followed by the polishing action of the laser, we call it PTK, phototherapeutic laser treatment. But what that tends to do as a side effect is it makes the eye a little more far-sighted. So that sometimes makes it undesirable. And the way to think of that, it's a bit like, when people are cleaning the office floor in the lobby of nice buildings, the model, and got that hovering thing. It's a bit like that with a laser. So, though I've done that many times, and I have usually abraded corneas on these rare occasions and have prevailed. Now, if you look at the literature on the laser polishing after the scratch as the best thing that's published, and I was I was in the center, which was one of the study sites for the American FDA trial for this in the 90s. There are patients that have erosions without having any surgery, and so just like you're having. And so these patients came and had this laser polishing, and it eliminates the symptoms during the 2 years of the study. But because we're looking after patients beyond that, but it was outside the purview of the study, we noticed that a few patients were coming back in the third year saying, well, it's coming back a little bit now. So, that is something that works. It's not always forever in all patients, but I don't think it has any major advantage over considering if this gets beyond your tolerance, just re-abrading a cornea. So that's the way to manage erosions. Now, you also have this coexisting nearsightedness. And so if the nearsightedness that we are looking at were going to be stable, and obviously one measurement a year ago and one measurement now isn't really enough of a data point. So we're not sort of going to pursue this. I'm going to say, find a way to come to me in the next 2 to 3 months and we're going to double check the measurements. You would say, well, what about abrading the cornea because I'm getting pissed off with this erosion stuff, and at the same time change the power of my eye in favor of better distance vision, so that you would be enrolling as the third in that third treatment, box, which is 0.5% of the population. So that's the additional. Let's deal with kill the two birds with one stone. If the erosions came under better control and the dryness were more of an issue, and I was reluctant to do anything in the cornea as procedure number 3 for fear of pushing you off the dryness cliff, worse than my 4 drops a day line in the sand, then the other way to manipulate the power of the eye, we talked about this last time, is to alter the inside of the eye by taking the lens, your human lens out, simulating a cataract operation at a time when you don't really have cataract, but in the sense of needing surgery. And by smartly picking the lens implant power, we can change the power of the eye and improve the distance vision in that way. So that's another fork, another lane to choose. So there are ways to manage this. The road is paved. The left eye, while we're on the subject, I think we should keep tabs on the left eye so that, and coming back in about 3 months would not be a bad thing, so that we can look at the measurement in that eye. Now, that's where I think where the management lies, getting you comfortable with plumber's type drops, and then thinking big picture about whether we would do something interventionally. Would it be just to address the erosion, or the erosion and the nearsightedness? I've given you some.
To be honest, I'm quite scared to have anything done.
And my next comment was this, that if ever we got to talk about that, what we would do is I would say, go see someone outside the company walls, and generally I send patients to, 2 or 3 people, or I know everyone in town, but the people I think that have good social skills and have great clinical acumen that do these procedures. There's a guy called David O'Brien, who's a consultant at St Thomas's Hospital, who does this work. He's done it a year or 2 longer than me even. And he's a cornea-trained surgeon, and he sees patients, and we can arrange for you to see him on $1. And then Professor William Ayliffe, who's a cornea specialist, he's also got a PhD in immunology. He turned down a job, the cornea surgeon job at Harvard. He's no dope either. At Moorfields, there are several good guys. The guy I like is Bruce Allen, because he's, I think, father of 3, lovely guy, very sociable, nice, and skilled to boot as well. So I'm picking people where you can have a frank dialogue, and they're not acting all sort of posh and looking down the nose sort of at you and making the atmosphere difficult. So that, I think, would be a must-have if ever we were going to go in the room with you and me with gloves on. So I would insist on that probably, given, and you would say, me too. So that's the road I think we should pursue, because otherwise, I was in this situation, you're coming into a clinic, you are my patient, but I tend to see problem patients, anyone with a problem, it's my background to do so. I always tell doctors, put your knowledge in the patient's head and then imagine what you would do. And so obviously, you're a bit gun-shy right now. You think, well, I understand what you're telling me, but I'm still not happy. I've, ponied up this money and look, we're in no man's land. I'm not happy, and I'm not sleeping well.
I've asked my money back.
And what you got with it?
They just said we decline your request. I mean,
did they respond in any detail to you?
No, just that they're going to, keep on the ongoing treatment. But I'm just not happy with it. I'm at the age, I don't want lots of messing about now.
No.
And if I can...
You emailed me. I always offer myself up as Karen Fodder to be the messenger of the email, just because I know I can get it to the right person. And if we
Sean Hannan is the guy who...
Stephen Hannan.
Stephen Hannan. And he's not interested, and they're advertising it. 100% money back if you're not satisfied.
I think even a higher standard than that, it's, 2020. All your money back. And so what he would say to you...
I haven't got my 2020. I had it for 5 months.
However, I think what he would say to you is, the corporate answer to that, it's not my particular point of view, would be the time that you had the surgery predated when they did that. I've never done the 2020 or your money back thing because I'm an academic and worked in the States, and it's not cool for me to see that. But from a business perspective, the guy that owns the company puts that out there as much as I probably wouldn't, because he knows that only 2% of patients, in terms of the whole population of patients we treat, don't achieve 20/20.
Yeah.
And so he will underwrite that 2%. Because he knows that when he puts one of these adverts out, but it's not for me, he's going to get more people in the 98% group in absolute numbers. So he actually has more revenue, even though he is offering up the 20/20 money back. But your point is well made, and if you still have my email address, I'll make sure you have it. But feel free to email me again. I'm happy for you to say, look, nice to see you, but I'm still not happy, even though I understand this management. I'm not happy because. Or you can directly email the guys, but I'm happy if you wanted to use me as a conduit for that.
So would you be able to do something then?
That I can't do anything about that because it's not my company. I don't hold the purse strings of the company. If it were my own private office in America where I used to work, then that's different.
Yeah.
So
see, I had no idea that there was going to be that there could be any risk at all. When I went for my consultation, he told me I was a perfect candidate, and so therefore I assumed I was a perfect candidate, and I didn't know anything about risks. I didn't know anything about dry eye. I had no idea of anything.
Yeah, I think in general terms, there's no zero risk and there's no 100% effectiveness. But I think what you're saying is you're not suggesting that. You're saying that you were led to believe that the risks were minimal and that it was a very safe thing.
He never mentioned risk.
Well, Stephen Hemming would say this too. I'm just thinking.
Yeah.
He would say, we gave you a consent form which clearly delineated all of the issues, including the risks and the benefits of the treatment alternatives, which you read and signed. Yeah. And he's going to just sit back.
Yeah, that's what he is doing.
And, I think that's corporate, but I think, again, I think it's a defendable position if we're just talking sort of, informally about it. And so I'm quite happy to be an ambassador for you and say, look, this lady's unhappy, let's make her happy. And in the meantime, it won't violate your ability to come and see me, and we can be doctor and patient together. And it won't alter your ability to have you see someone external just for peace of mind if you do walk down any of the paths we've delineated today. So nothing will offend me if that.
After the consultation, he told me it was going to, as I said, it was going to be for the rest of my life, and then I've been told now I could only have got a year or 2 years out at my age, 57.
No, that's incorrect, and that isn't a correct statement. As I said, that's not borne out by what's published in the literature. I'm a very evidence-based person, and there's nothing in the literature that says that. That says that at 57 you will only get a year or two out of it. No,
that's not true.
No, it isn't a true statement. Basically, as we get older, frankly, north of 50, that's me as well, I'm always looking to see if I can see any evidence of not age-appropriate aging of the lens inside the eye, which we both have, rather, that cataract of the patient says, well, yeah, I'm diabetic, and everyone in my family before the age of 60 has had cataract surgery. Then I'm ding, 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 and I'm thinking, well, why don't we just not do it and just wait for a cataract and do that either on the NHS or sooner somewhere else. So absent that might explain that 1 or 2 years. If you operated on someone at 58 and then he says, oh, by the way, everyone at age 60 in my family has cataract surgery, then you've created a 1 or 2 year scenario. But in the absence of that, there isn't anything that would support what you were told. Okay? I think that what I said, again, which is published data, is that beyond the first year, for the following 4 or 5, we're talking about 1 or 2% of patients that will end up having a dialogue about the potential for further surgery. So it's more, obviously you're in that group.
Yeah, again, I wish I had never, ever had laser treatment.
You would, because you would, now I'm telling you that, you're thinking that's no comfort for me.
No, it's no comfort.
I was led to believe that the risk was minimal and that I wouldn't be holding hands with you this much or years later.
I mean, I've actually gone full circle. I've been wearing contact lenses since I was 21, and now I'm back to the same, my size is the same now as what it's really not the same,
But it may as well be because unless you're close enough to zero, it doesn't matter whether your glasses are a millimetre thick or 2 millimetres thick. That's what you're trying to say.
So, I mean, I can't wear contact lenses now ever again, can I?
Well, you can, but the qualifier would be that you couldn't wear any brand whatsoever. The soft contact lenses have a water content, and it's different as a percentage for different brands. And the patient with a dry eye can wear contact lenses, but sometimes, or usually, we're looking for low water content lenses, because the higher water content lenses, which transmit oxygen more faithfully, are not good for a dry eye patient, because water evaporates from the contact lens. And where does that contact lens go for more water? The surface of your eye. So it steals water from your eye.
Yeah.
So your point is a good one, that's correct. But by choosing the brand, the Puma lens, not the Reebok lens, wherever it would be, you can find a lens that is tolerable. But then again, it's frustrating because you think, well, I didn't expect to need contact lenses. So we're back to whether or not we would ever do any further surgery, and that's something that would only happen if I pushed you outside the company walls and said, you go see one of these guys in town, and we'll make better sense of that. And maybe we'll do that anyway if you want. I'm happy to set that up. That might be helpful. Because it is frustrating, I understand. And separately, if you want to email me or to email the company directly, just to reiterate, that you're pissed off and, you're ponying up this money and you're sort of in no man's land and blah, blah, blah. By all means, use me if you need. You won't offend me at all, because I'm just interested in looking after you medically, and you can bark at the company and via me or directly. It doesn't change you hanging out with me, just to be clear.
Well, can I improve the glasses I'm wearing now?
Sure, absolutely. What is the local, what's the most convenient place for you to be in terms of going into a store picking up frames, because we do not have a dispensing on
Croydon, probably.
Croydon. So I'm going to write in the file that you can march into Croydon anytime you like.
Right.
Not 2 in the morning on a Tuesday, but whenever they're open, and I'm not sure whether they're open every day or most days, and then you can just pick frame off the wall. If you want to keep those, pick the frame off the wall and they'll dispense something else. And do you want them, now are they sort of very vocal, or are they single focus?
I can actually, can read it. I can read okay, but it's the distance.
Yeah, so I'm going to single vision distance, and we'll put a coating on them so that it diminishes any glare for night driving and what have you. And that's something that will be helpful. I'm going to give you a crib sheet for this. And then, so the homework for this is that I want to get a sense of whether this Lubrasil gel helps you at night in place of the Spanish one. Okay? Right. You're welcome to try it. Take home the Spanish one as a comparison. I'm sorry, the sodium chloride, the salt. It's got Spanish labeling on it, so I can explain. Do you want to have one of those? Is that really late? Just because it didn't help last time, but wouldn't it be nice to be able to compare it to the goofy one? Yeah. All right. So I'll go for that.
Should I notice the difference? On one night,
for a few days. A few means like 2 or 3 or 4 days. And it's specifically that sharpness, that warning sharpness where you think like, oh, God, no. And you're thinking like, oh, I hope this doesn't, that feeling. I want to try and get a handle on that, because there's no way to live. It's I understand.
Again, if I had known, you didn't even tell me I could have this problem.
It's so unusual, though, because as I said, the great irony is that it's published as a remedy for this. And so occasionally you get it. And then...
the dry eye?
No, not the dry, the erosion thing.
The erosion.
The erosion.
Well, even the dry eye, I didn't even know that. I didn't know that was going to happen.
Well, again, I think that these things happen. Not everyone gets them, but, the exhaustive detail, we summarize as best we can so that patients can read through everything and then get a better understanding. And, I'm someone who just glosses over everything, and I'm not criticizing you, but I'm someone that does that. Yeah. And so, I hate people like, buying a house. I've done that for a long time, but like, all that paper, I hate that. So I would be the same as you. I think, and it's good. I'm good, kept fine. Yeah. And then I get frustrated. So I understand how it happens.
And most people don't read terms and conditions very closely. That's why I think when the consultant said to me, or the optometrist said to me in Crawley, you're a perfect candidate for laser treatment, I believed him. He didn't mention risk. I believed him. And that's what really pissed me off. Because our eyes are our most precious things. And then this happens to me.
Sure.
I'm just not happy. I'm not happy at all. despair. I wish I'd never even done it. I was quite happy with my contact lens and my glasses. And now I'm screwed, basically.
Well, there is a process here that we talked about, and we'll consider it, but I think that we'll do the simple thing first, and then... Thank you, sir. And these are different appointments. This is the easy one to try.
Yeah.
Lubricil gel, the big box there, at night.
Yeah.
Or you could try the sodium chloride. I'm going to write Spanish there, so I'm going to write Spanish there, so you know, that's the one with the Spanish writing. Okay. That's the one you tried before, that from East Winston. Or you could try the other simple lubricant at night, the gel Clinitas Hydrate. Right. So that's like the Diet Coke of all of them as well. Patients really like that. But the ones that specifically goes after the erosion symptoms are these two fellas.
Yeah.
But this one's good. So try that. Have a trip down memory lane. And you can always revert to this one to see if you just need lubrication at night as a remedy for this.
Right, okay.
In the daytime, Optic Plus here, about 3 times a day, could be 4. What it tends to do is it tends to make someone crave drops less, make the eye not symptomatic. And so it's a brand, all their products seem to do this. And then on a daily basis or every couple of days, the eye bag, I'm sending it to you, hence the envelope.
Right.
It's a gel mask that goes in the microwave, warm it up, and like cucumber slices on the eyes, you just leave it there. It's for 5-10 minutes. It softens up the oils in the lid, and then by wiping with these Clever Clean wipes, it de-oils the eyelids a little bit, which can stabilize the tear film a little bit.
Right.
So anything that makes the eyes less dry, whether it's improving the eyelids or lubricating, is going to potentially help these symptoms that you're getting. But the ointment at night might be the mainstay.
When I wake up in the middle of the night and I've got really, if I've got really sore, this soreness, do I want to try and put it in my eye?
Do you want to put is it easier to put an eye drop in or also this gel?
It's easier to put an eye drop in because I can just lie there and do it. Whereas with gel, I've got to get up.
The blandest thing, a preservative-free thing would be something like Celluvisc, which you've been given before. It's not a great thing for the daytime, but it's sort of quite viscous. Or we could give you a pump bottle of something where you can easily grab it, like Hypercent.
Yeah, the Hypercent's fine actually.
Go ahead and do that.
Yeah.
So then I'll write that.
I have used that before.
Red one.
Could I have a cotton?
Yeah. Hypercent red overnight if needed. So that's that. So that's the sort of like homework with the patient. Do you want me to have head office contact you to set up a trip to one of my contemporaries outside the company? We'll do that.
Yeah.
Because, I think it occasionally, some light bulb will go off, and it's a light bulb I'm not seeing. I'm humble enough to be happy to have that happen.
Okay.
And then at minimum, it sort of validates what I'm saying to you and makes you think like, I'm not happy, but I'll go back and see that guy. It allows you to think, all right, okay.
Yeah.
Still frustrated, but I found that helpful. So that's usually why I do it.
Yeah.
There's only a few things going on here, but they're frustrating, and seeing someone else to as a double check is good psychologically.
Right. Okay, yeah, that's fine then.
Now, you've got my email address.
I haven't actually.
I'm going to email you now. It's probably easiest than you writing it down. Let's see. Are you CT Robertson at mail.com?
Yeah.
CT Robertson. CT Robertson. See if I can write that correctly. CT Robertson at mail.com. Okay, good. Okay, that's done.
Okay.
So email me for anything, and I will. Why don't we say this? If no one has contacted you by the end of next week about an external opinion, drop me a line, okay?
Yeah.
And then that'll allow me to go shake their cage and say, all right. One of the two guys, David O'Brat and Will Ailiff, they're the guys who will really be worth seeing because they're doing corneal surgery and corneal refracted laser surgery, so they're like the double guys.
Where are they?
Will sees patients either on the Victoria Embankment at the Lister Hospital or at Shirley Oaks Hospital, which is in...
I know that is Shirley.
Yeah, there. Is Sheen, is it? Or
it's
no, not Sheen. Croydon, yeah. So that's what he's there, because he used to be a consultant as well at the Mayday.
Right.
And he's a great guy. David O'Brat sees patients up here. And he's also at St Thomas's Hospital, but privately he sees patients up here. So Will Ailiff, the prof, gives you a bit more flexibility to be nearer to home.
Yes, yeah.
Right?
I mean, I'm not having the abrasion in my right eye because of the LASIK.
No, I think you are. Yeah. Well, again, my late mother-in-law would say, Jonathan, like, really? Yeah, of course, because you didn't have a problem. Jonathan scratched the eyes, procedure number 2, and you got the problem. And, 5-year-olds would say, well, yeah. But the irony here is that typically scratching the eye is what we do to stop that.
Yeah.
And so it would take a little bit of an intellectual leap of faith for you to think, okay, I'll let you scratch the eye because you're thinking, like, damn, well, created a problem. I must be nuts to do this. And so that's one other reason why we'll hear from
and that's another symptom of, is that normal for that to happen after LASIK?
Well, it can. It's rare after LASIK. It can happen. And I think rare things are common for me because things get referred to me. But, to give you an idea, I haven't had a patient, you're probably the second patient in, I took a low number, 5 years, maybe even longer, where I have looked after this.
Right, but this problem has occurred.
Yeah, so where the erosions overnight after LASIK.
Oh, right, okay, yeah.
Specifically. So that's a rare thing for me, but I see it because I get problems referred to me. So I get this skewed impression of how frequent it is. It's rare. Right, which is no consolation for you, of course, but... No. All right. Other things to talk about before I let you escape.
Well, the glasses.
I can write that down, and that can happen. Easily.
So I can go to Croydon and just get some.
You can go in there any time and say, "Give me those glasses," and they'll do that. They'll let you take frames if you want to keep those as well. Yeah. And that's that. You'll email me by the end of next week if no joy regarding an external opinion. I'll help escort you through that process. Okay. If you want to go bark at the company, you can do it through me. If you want to just go bark directly, and I'm just being candid. I'm not being facetious saying that because it is frustrating. And then I guess once we've had you see someone externally, you can come back to me at some point in the next month or 2 or 3 at your convenience. Right. Sorry, sounds like a plan?
Yeah, okay.
All right, so again, I understand. I'll try and get you through all of this.
Okay.
And you've got your shopping bag.
All right, then.
All right.
I've got my coat.
All right, safe travel through. You'll be on the system instantly. So if you went down there in a helicopter and I got this on your list, it's all good. Anyone gives you the dog with the funny noise, then I just say, look at my medical record, and it'll be written down. Clear as day.
Okay, then. Thank you. Bye-bye.